Okay, we get lots of questions about leucovorin and what that looks like and how we do it and what it does and all those sorts of things. I've done lots of videos in the past on it, but I kind of wanted to walk through a case study. Now, this is a specific patient. They are unidentifiable, and I did get permission to share their story. And I just wanted to walk through how we approach it, what we did, what the results were. And so I'm going to use my iPad. I probably should be looking at the camera more, but I'm going to be looking at my iPad and walking you through because I think the visuals are helpful to see what was said and how we approached it and all those sorts of things. Basically, this, first and foremost, the child was 3.5 years old when we started seeing them, and they were autistic. They were diagnosed with autism already. And, when you think about the different levels of the support needs or those sorts of things, there's a lot of different ways to describe it. Every child is unique, and so it's hard to give a big label of where they're at, but they were labeled as high support needs or level 3. They are from Canada. Now, we can't see Canadian patients in our office, but I'm going to share with you how we helped this family and then kind of just kept in contact with them as we went along. They had seen me posting about it over the summer. This was before the Maha report and all those sorts of things had come out about leucovorin and heard online, worked through all those things. What we did is we obviously couldn't see them because they live way up in our neighbor to the north, not even in our country. But what we did was we just talked through and I gave them a packet of research articles, protocols, those sorts of things, to then pass along to their primary care physician to talk through those things. Now, this child, I'll just give you a little bit more background information. So 3.5 years old, was a 35-week preemie, so a little bit premature. Family history of autism on at least one side, maybe both sides, I can't quite remember off the top of my head, was taking omega-3s, like the fatty acids, for brain support and development, but no other medications or anything along those lines, was in language and support, and then was on a long waiting list for any sort of specific autism-related support, like years and years before could get in with any sort of autism-specific support because it's hard to get into, and in other countries it can be even more challenging to get into. So we met, we talked through things, I gave them the packet, and this is what the first response was, is I can't get in with our doctor. Oops, I just want to make sure you can see this. A little bit of update, can't get in with appointment until July 4th. In general, he thinks supplements are useless and not effective. He also said that there's not enough substantial research about folinic acid and sees no point in prescribing it, but will reach out to one of his other doctor friends to see. This is a common response. This is not an atypical sort of first response. It can be hard to get support when you want to try something that isn't in the guidelines per se. Now, there's good research, there's double-blind placebo-controlled studies that show effectiveness. There aren't huge mega trials, it's not in all of the guidelines yet. And yet, my take on it, which I've shared many times on Substack videos and all those sorts of things, is first and foremost, it's a vitamin, which at least to me says, okay, this is probably going to be low risk if used appropriately. It's also inexpensive. In the US, insurance typically covers it, or maybe it's like $30 or $40 out of pocket without insurance for it. So it's not expensive. And it is a vitamin that's a prescription, leucovorin is, which at least to me gives me peace of mind that, okay, this is a prescription. It's coming from a regulated facility. It's not some Dr. Oz supplement that you get on Amazon and you have no idea what's in it. There's no regulation. So those things to me give me peace of mind. And I tell parents, this is typically worth a try because it's low risk. It is not dangerous to try. It is inexpensive. And we will see within a few months if it makes a difference or not. And if it doesn't make a difference, then it was a vitamin that we took for a couple of months that we then can check off the list as this isn't something that helps my child to thrive more. I have lots more videos and things along those lines on my Substack. Then the next week or two later, she texted me and said, great news. We got in earlier than expected, and he prescribed the leucovorin. He said that no Canadian physicians are ordering it. And then one of the things that she said is maybe it's wishful thinking, but by her fourth dose, she is starting to consistently look at people when they call her name. And this is something that we hear from time to time is we see some early indicators that maybe something is going on. Now, when we talk about side effects, and I talk about this in some of my other videos, one of the common side effects that we will see in some children is they're a little bit more wired for sound for the first couple of days after starting on the medicine. I usually attribute this to like their brain is experiencing more folate than it has before through getting folinic acid in via the alternate receptors. it's usually just for a couple of days that we see the wiredness or the aggression or the more hyperactive or irritable. But we do often see parents that will say, we did notice a little bit of a difference. And I'm a skeptic by nature. And so I say, okay, let's just wait and see. Awesome that you noticed this. Obviously, there's oftentimes some placebo effect because they're giving something and expecting some sort of result. And so they might just notice things that they hadn't noticed before. TBD. About 4 weeks later, the mom texts me again. This is just kind of nice. Like we don't have any sort of like her doctor is prescribing it. She's just keeping me in the loop because we kind of started down this track together. 4 weeks later, more interested in her sister. She's also taking some of the baby dolls, giving them a kiss and saying night night. She did mention the irritation didn't happen during the first week of dosing. It came when we went up to BID. BID means twice per day. But to be fair, she had huge changes in daycare and the school started that week essentially, so it's tough to know. But otherwise, it then passed and she's been great ever since. And then the other things that she kind of just gave me like a litany of the different things that they've noticed. One of them is she's making much more eye contact, making kissing faces and saying moi, and the eloping. Eloping is something that is common in autistic children where they run off. They might get out of the car and take off. They might go out the back door or run away from school or something along those lines. Her younger sister started soccer. It's a huge field with a playground. Concerned about eloping. In previous years, she was an eloper. Instead, she likes to run close to where we are standing, makes no effort to run back to the parking lot or to the road, and she's even tried kicking the soccer ball a couple of times too, which is kind of just nice. Okay, so those are nice subjective things. I want to talk about some of the objective measures that we noted. So we do objective testing every month for the first 6 months before we start leucovorin, and then monthly for at least the first 6 months so that we have some objective measures. Because it's hard with the vibes or just the gut feeling that something is different to know, is this something that we're noticing more because we started a medication, or is this something that's actually different? And so that's why we do objective symptom-based testing month after month, where they fill out a standardized form that's a standard free form called the ATEC, A-T-E-C. This is a form that we have them fill out. It's a free form, it's online. And what we do is we capture a bunch of different data points, and then we can say, objectively, we've seen a change, or objectively, we really haven't seen a difference 6 months starting this medication. I don't think we need to continue this. This isn't a tree to keep barking up when it's not bearing fruit. Okay, so the first area, there's 4 different areas that this test really looks at. The first is speech, language, and communication. Hopefully you can kind of see this on the screen here. Things like responding to no or to stop, following commands, knows words, asks meaningful questions, carries on fairly good conversation. You get a score for each of those answers, and we get a total score then for this subcategory. So in June, before she started the medicine, her score was 22 of 28. The higher the number, the more autistic symptoms that we're seeing. October, same question set. It went from 22 to 18. So a sizable difference when you think and do the math of like what's 18 divided by 22. Okay, I can't do the math in my head, but that's 4 points difference on one, which is a 20% improvement or something along those lines. This is on sociability. So let's see, some of the big things is like ignores other people, pays little attention to when they're addressed, shows no affection, fails to greet parents, does not wave bye-bye, temper tantrums, lacks friends or companions, insensitive to others' feelings, indifferent if parents leave. In this case, so this is kind of the way that we connect with others in the world. Her initial score was 19. Hopefully you can see that if I just zoom in. 19, and her repeat score 6 months later was 15. So again, improved 4 points there over the course of those 6 months. And we could go through line by line and see. I don't think that we need to get into that sort of weeds right now. This next area is sensory cognitive awareness. And so this is things like looking at people and animals, appropriate facial expressions, aware of environment, aware of danger, dresses self, curious, interested, tuned in as in not spacey, looks where others are looking. Her initial score before starting was 24. 4 months later, 17. So that's like 7 points difference. And then the last category is health and physical behavior challenges. Now, some of these overlap with being a toddler. And so it's not always super helpful for these in terms of bedwetting or having accidents, diarrhea, constipation. Those can be a lot of different things, not necessarily specifically autistic related symptoms. Hyperactive, lethargic, hits self or injures others, destructive, sound sensitive, seizures, obsessive speech, rigid routines, not sensitive to pain, hooked on or fixated on certain topics. Like, some of these are normal things that children experience. And so it's not necessarily all things that we have to try and change. That's not the purpose, but it is just giving us a broader picture of what sort of symptoms we're seeing. When we look at her total overall score across, those 4 domains, her initial score was 77 out of 179, and her repeat, this was 6 months later, is 62 out of 179. When you do the math, that is overall a 20% improvement in her symptoms related to autism. Now, we get that data, and then lastly, we get some subjective information. So in the big picture, how are things going? Things have been better. We could have probably predicted that answer based on the objective information. She's playing functionally with her toys. She loves playing with foods, like plastic and wooden foods. Now she's pairing foods with playing appropriately, like she's doing some intentional play. We also notice a lot more appropriate communication. In the past, when she was upset, she would say, "I love you," or EIO would be used. This is dropped to non-existent and now has been replaced with something that's appropriate. So before, she was upset and she was kind of echoing like "I love you" or EIO when she was upset. Now when she becomes upset, she starts yelling "no, bad, bad, bad." Appropriate words that she's trying to express and able to express, so she's able to communicate better what she's feeling and what she likes and what she dislikes. Prior to starting folinic acid, I would have said engagement with requests was 20%. Now it's easily at 50%, so another great name. Now she transitioned effortlessly to junior kindergarten, adapting to the substitute educational assistance. Engagement with peers is better, aware and tolerant of her younger sister. Challenges on your plate. One of the things that she said is hugely challenging is getting her coat on for school. However, at school, she puts it on mostly with no issues. We ask about what challenges they're facing now because there's often things where we can be like, "Did you try this?" Or "That makes me think about this." We can give them more ideas and more help in other ways when we know what challenges are on their plate at the moment. It sounds like this one, and she said this is pretty minor. Now, this is what sparked the whole thing, was this text out of the blue the other day where she said she has become so much more intentional, appropriate when playing. I wasn't sure I'd ever see the day, but lately she has been so much. She settled wonderfully into kindergarten and is meeting all of their expectations. And she sent me this sweet picture of her 4-year-old now playing like appropriately with play foods as one would. Does this change her diagnosis? No, of course not. I think of autism, I think of ADHD, I think of neurodiversity as a operating system. And so getting Microsoft Word for your Macintosh computer doesn't change that it's a Macintosh or an Apple computer anymore, but it might make it easier to communicate with colleagues that use a PC. That's kind of an okay analogy. It's not the best one I've ever had. It doesn't change the diagnosis. Is it life-altering? Maybe in some ways it is life-altering. It doesn't change everything. Could it change a trajectory for a child that wasn't able to communicate, that's able to communicate better now? Yeah, I think that is one of the things that we would work towards. It allows her to communicate her needs. It allows her to connect differently, enjoy life more. Autistic kids, autistic adults are such a treasure, and what we should be focused on is helping support them and help them to thrive. And so my big push and discussion of this before all the reports and things from Maha and whatnot was that we should be focused on the different ways that we can help autistic children thrive. One of them is biology, and under the subheading of biology, there's things like sleep, there's things like movement, there's things like nutrition, and one of them specifically is in the nutritional realm, is making sure that they don't have anything like anti-folate receptor antibodies or cerebral folate deficiency or low folate levels in their brain that is making it difficult for them to thrive. So if we can uncover that, make sure that's not an issue, then we can focus on other things and make sure that we're supporting them in a more whole child sort of way so that we're able to help them thrive in their beautiful way in the world that we want to encourage them to be a part of in every way that they want. Yeah. Hopefully that's helpful. Comment below, share your thoughts, feedback, questions, and I'll do my best to answer. And if this has been helpful, if you liked kind of this case study, then I can do more of them.